free plays.
Have you taken residence on the sideline of your kids' baseball, lacrosse, or soccer game? Spring sports are in full swing, and with them, the all-too real reality of bumps, bruises, and concussions even. Dr. Matt Hall is a UConn Health sports medicine specialist and director of the UConn Sports Concussion Program. He's joining me now. Good morning to you, and thanks for coming in.
Thanks for having me.
Important time to talk about this because it's inevitable. Kids are out there playing sports, some are going to get hurt. What kinds of things are we seeing?
Well, you see the full gamut from head injuries, head to toe kind of injuries, knees, ankles certainly are the most common, shoulders. Those are all things that we see all the time.
Now, what about concussions? Because this is something that, you know, there's been so much data, so much discussion and even debate over concussions and what it means and how to deal with them and all that sort of thing. Is there a certain group that's more susceptible to concussions, or is everyone potentially at risk?
Everybody is potentially at risk. Really, contact sports, certainly. Yeah. Sports, football, soccer, those are more susceptible. Really, the issue is that kids need to be removed if there is any suspicion that they have that type of injury, because really they get better. 1 to 2 weeks is really the max in the standard or kind of average out of time. But if they continue playing, they're at risk of being out for a longer period of time.
And should parents listen? Oh, I feel fine, I'm good. Maybe that's when you have to make the bigger call, right? Just because they feel good, or they're saying that they're willing to play with the pain because they want to play. Time to step in maybe and make a bigger decision.
Yeah, I mean, that's the difficult part about head injuries in particular, is that we don't really have a good way to test them. Yeah. So we really rely on the athlete to kind of tell us what they're feeling and how they're doing.
So we want to figure out ways to keep the kids from visiting the ER. What's some advice you can give for that?
Well, it's, you know, really basic kind of rules, but protective equipment is really important. So helmets, mouth guards, elbow pads, knee pads, those kind of things are really important. And those are regulated in organized sports, but outside of the organized sports, biking, skateboarding, rollerblading, it's important that they have that type of protective equipment.
Yeah, especially when it's a choice. You know, it's for teams, often they mandate you need this, this, and this. But when it's your choice, often kids are like, I'm fine. Right. But headwear especially, so crucial, so almost important. No matter what you're doing, right? You know, a lot of people say, well, look at the majors, you know, pro baseball players, they go to spring training, they learn how to warm up, cool down, get their bodies moving again after the winter, which we all just basically hibernated, right? So, but kids don't have that. They kind of hit the ground running, and can that make you more prone to injury? Yeah,
so certainly building up slowly over time, you're right, it's cold, a lot less sunlight, and kids get excited. We all get excited. You want to go out and really get active, but really a slow build-up over time, gradually increasing the intensity and the level of your sport is really important to kind of prevent against injury.
And we've got some tips we can talk about here about how children can prevent injuries. Be in proper condition to play the sport you're going to play, right? That's important, as well as you mentioned, wear appropriate gear. What about don't play when you're tired or in pain?
Yeah, so fatigue, anytime there's fatigue associated, you can be susceptible to an injury. And pain, so when pain is there, muscle groups don't work very effectively, and you could injure that body part even worse, or another body part because you have that pain that's associated with the exercise.
So maybe don't try and be a hero. Don't try.
Yeah, don't be a hero.
There's going to be another game. You're going to be able to play again. Yeah, you want to take care of your injury, figure out what it is. And then you mentioned as well, warm up and cool down. It's the first thing people cut out. They think, I don't have time, I'm just going to go out there and play. But it could be argued that it's one of the most important times, right? Yeah,
well, warm up and cool down are important. And I think people are pretty good about stretching, but making sure you have some type of dynamic exercise or warm-up is really important. So that's a light jogging, a little light drills that might be associated with your sport to kind of get everything moving, get the muscles all working together.
It's never been more competitive, right, with sports, especially at a young age. And so many parents are like, well, you know, little Jimmy's just going to play soccer because I want him to be really good at soccer and he really likes soccer. But then he's not playing tennis, or he's not playing swimming or anything else. And so essentially he's just working one set of muscles. Are you of the belief that cross-training is probably better for a number of reasons, but also might keep the student-athlete safer?
Yeah, I think particularly early on in the youth population, having them do multiple different sports and activity is important. We are seeing more and more kids focus on one sport earlier and earlier, and they use one body part, one set of muscle groups over and over throughout the whole year without much rest or break, and that can give them problems and get overuse injuries with their arm, shoulder, things like that.
Or even burn them out and make them sick of that sport.
Yeah, you always run the risk that they stop enjoying it how they did at the beginning because they're constantly doing that one activity.
Dr. Matt Hall, some really, really good advice. Hopefully we just kept someone safer because of this discussion, so thanks for coming in.
Thank you.